Hi and welcome. This is Eric, and today I'm going to discuss what EHR is. So, this is the second video series, so please watch the previous video to understand where I'm coming from. But in short, this is not a theory video series, but more of a practical video series. Okay, so watch the previous video series to understand where we are coming from. But EHR, in short, stands for Electronic Health Record. Okay, so EHR, really these are real-time patient-centered records that make information available instantly and securely to authorized users. Okay, so when you go to the hospital, they ask you for your information. Most of the time, they enter that to some kind of EHR system. If you go to a doctor's office, they wanna do blood work, all that they enter your information or lab results, or sometimes maybe you're taking like X-ray. They enter all that information to EHR. I'm just trying to give you different examples so that you understand what EHR is. It's not something which is really um, out of this world. Okay, it's just things we use on our day-to-day activities. If you go to pharmacy, or if the doctor sends the medication to pharmacy, you go there, you get your medications, they enter that information there. You go to refill your prescriptions, they really enter all that information. So all that information is connected under one umbrella. We call it electronic health record. Okay, so I'm gonna go through the definition here. While an EHR does contain medical and treatment histories of patients, an EHR system is built to go beyond standard clinical data collection in a provider's office and can be inclusive of a broader view of a patient care. Okay, so EHR, what does EHR contains? It contains patient medical history, diagnosis, medications, treatment plans, immunization dates, allergies, radiology images, and laboratory test results. Okay, allows access to evidence-based tools that providers can use to make decisions about patient care, and also automates and streamline provider workflow. Okay, so this information here is connected to your medical history, maybe sometimes even your family history. Okay, diagnosis, if they diagnose anything, they're gonna enter into EHR system. Okay, medications or treatment plans and all that. Okay, so if you ask me what I think about EHR, I picture something like this. Okay, from a primary healthcare to your diagnosis labs, when you go to the hospital, pharmacies, okay, and all that. All this information is really gathered and put in a electronic system. Okay, and then in here, patient can access the information, provider can access patient information, and it can either be in one system or separate individual systems, but connected somewhere. Okay, so if you go to the hospital, maybe they may have multiple really systems. Okay, if you go to their pharmacy, they're gonna have a different system. If you go to a doctor's office, they're gonna have a separate system. One of the key features of an EHR is that Healthcare information can be curated and managed by authorized providers in a digital format capable of being shared with other providers across more than one healthcare organization. EHRs are built to share information with other healthcare providers and organizations, such as laboratories, specialists, medical imaging facilities, pharmacies, emergency facilities, and school and workplace clinics. So they contain information from all clinicians involved in patient care. Okay, and we do have some of the advantages, but really I like to go through the benefit of EHR. Actually, it improves patient care because the information is in there. It contains your diagnosis, sometimes your medications, so doctors can really figure out what was wrong with you, maybe previous years, or what medication helped you, and all that. Increases patient participation. Oh, I'm sorry about that. Increases patient participation. Okay, improves care coordination, improves diagnostics, and patient outcomes, and practices efficient and cost saving. Okay. Other advantages really it provides accurate, up-to-date, and complete information about the patient at the point of care. It enables quick access to patients' records for more coordinated and efficient care. Also, secure share electronic information with patient and other clinicians. It's secure because you don't have to print papers and go maybe take the papers somewhere else. If you forget them somewhere, forget to shred, it's not that secure really. But if it's through the electronic, from the hospital to the pharmacy, or from one doctor to another, or from lab to doctor, it's just electronic. I don't have to print any or to work with any PHI. PHI stands for patient health information. Okay. Also, another advantage, it helps providers to effectively diagnose patient, reduce medical errors, and provide safer care. It improves patient and provider interactions and communication. Okay, and as well as healthcare convenient. So if doctors has any recommendation, he can put in the system, and then if you log into a profile, you as a patient, you can see that information. Anyways, I don't want to go deeper to all these information here. If you like to know more about EHR, please contact me. And there is a lot really to learn how to implement EHR. Okay, we can learn step by step on how to implement, how EHR system look like in the front end. Okay, we can see what information EHR really contains. So I have already mentioned some, but I will see the front end, and we can see even how to implement this, or how these systems interact. Okay, we can also learn about the difference between EMR and EHR. So if you need all this information, please contact me. You have my contacts here. reach me anytime. We can go through all these. And even if you implement like a small web application system, or we can use web services or maybe HL7 or FTP and see how really EHR is implemented, how it works, and all that good stuff. Just contact me. So in this video, I'll stop here, and what we've discussed really is what EHR is, advantages of EHR systems, and the benefit of EHR. So I don't want this video to be so long, so I'm gonna stop here, and I'm gonna create another video. So I'll see you in the next video. Thank you very much. You have a wonderful day.